Hello everyone. In this video, I would like to demonstrate anterior loop of mantle foramen on both sides. So this morning, I was asked by a student to determine what this opacity was. One of the differential he had was condensing osteitis, and he had difficulty figuring out what was going on in this side, on this side of the patient's jaw. But then I had him take an eye away from this area and just ask him to kind of appreciate the overall course of the mandibular canal bilaterally, and I asked him to pick out where the mantle foramen was. And I think for him to, I thought it was beneficial for him to see the other side, so I asked him to do that on this side. Obviously the contrast is not ideal. You can see the cortication of the mandibular canal, and based on its angulation we know it's going to course generally in this direction. When I told him to point out the mantle foramen, he pointed right here, which I agreed with him. So here's the mantle foramen, here's the course of the mandibular canal. So how did it get up there? Well, there's this loop. Right, here's the canal and it loops around, and this is where it exits. And applying that same feature that we saw on the other side, we can see that the same thing is occurring here as well. Here's the overall course of the mandibular canal, and there's a very prominent loop, and here's the location of the mantle foramen. So this is called anterior loop. So in fact, this had nothing to do with pathology, but it's just a normal bone. Granted, it does appear a little bit dense. It may be related to this patient's bone quality, but again, this was a normal anatomic feature of a patient. So you can see the anterior loop, mantle foramen, and let me see, I think we can also see part of the incisive nerve that's coursing anteriorly right here. So yeah, that's it for me. Anterior loop, just be sure that you can identify this, and knowing the clinical significance of identifying anterior loop is also important. Thank you very much, and please hit the subscription button and hit the like button. Thank you very much. See you next time.